Welcome to The Critical Window, Brain Building in the First 3 Years. Join us in discussing how parents, healthcare professionals, experts in early childhood development, and community agencies can support a child's first 3 years of development. We unpack the science and share practical strategies for giving every child the best possible start. Welcome. I'm Dr. Stephanie Montgomery with Build a Brain, Build a Life, Build a Community. And I'm joined here today with Carlton Ulmer, co-founder. And we're going to talk to you a little bit today about Build a Brain and how we came to be, the work that we're doing here locally, and then what we see as our future. So let's jump in, Carlton. I know we're really excited. We've been talking about this, really excited to bring the work of Build a Brain to our audience community. So tell us a little bit about yourself, Carlton, and how you got into Build a Brain.
Yeah, thank you so much, Stephanie. It's so exciting to kind of think fast forward 1 year. We've really been operating for about a year now and excited about the work we're doing. A little bit about myself. I'm a healthcare guy. Worked for HCA Healthcare for over 20 years. Prior to that, in a large private clinic in Georgia, and just have always been passionate about how we can care and improve human life and the work we do in early brain development. Of course, we're blessed by working with co-founder Quint Studer. So I got to meet Quint during my healthcare journey in hospitals as we really work to facilitate Studer principles. Fast forward, Quint has been in this Pensacola area and just a dynamic leader and driver of a lot of wonderful things here in Pensacola, but also nationally. Quint's a lifelong student of learning. He started off as a special education teacher and then went into healthcare, serves as a hospital administrator, actually here at Baptist Medical Center here in Pensacola. And then recently, just to talk about his work, received probably one of the greatest awards, which is the Malcolm Baldrige Leadership Award, which just happened, and we're just so proud of him. But our journey begins, which I'll talk about with Build a Brain shortly, as we work to further early brain development and doing some research. So Quint's dynamic. We love working with him. And maybe, Stephanie, share with the group a little bit more about yourself, too.
Yeah, well, you had me at research. So my background is in education. So retired from the state of Georgia, where I worked as a classroom teacher and then up at a district level and regional and state work, and really loved the work and continue to love the work. And I see that now, working with Build a Brain, I'm able to contribute to that work just in a different space. So my experiences in education and research, working with children and families and in the community with community agencies is such a nice fit, I think, for the work that we're doing. And I think as you lay out the journey and where we started and where we're going, it's just such a nice match, the work and the experiences, I think, that we bring to the company. So
yeah, we were
part of it.
Yeah, Quint and I were so excited to have Stephanie join the team. I'd known Stephanie for a long time prior, and while Quint and I are in healthcare, it meant a lot to bring on board someone who's got a doctorate in education, very focused on early developmental delays, specifically dyslexia, which I know you've spent an enormous amount of time in work in. So it just really worked well, and it's really exciting. So just a little bit of reflection on our journey on how we got here. It's pretty amazing. I happen to be CEO at West Florida Hospital here in Pensacola when I got a call from this guy named Quint Studer, and he was in discussions with Dr. Dana Suskin in Chicago. So a little bit about Dana Suskin, cochlear implant surgeon, and was doing some research and work with the University of Chicago and was wanting to show new parents a video to really, I think, provide evidence-based education to the parents about their role as the first teacher of their baby, but also how their baby's brain is going to develop during those first 3 years of life. And I know, Stephanie, you're going to delve into some of the science and evidence behind that. So Quint called me and said, hey, really interested in knowing if our birthing hospitals would like to participate in this 2-year clinical study with Dr. Dana Suskin and University of Chicago. And it's Quint. So what do you do? I just said, I don't know much about it yet, but it's a yes for me. And we had Mark Faulkner at Baptist and Susan Davis over at Sacred Heart. And so we all agreed. Fast forward, we participated in that 2-year study through the Studer Community Institute, which really helped to facilitate this relationship with the University of Chicago and Dr. Dana Suskin. We were able to get in front of just over 1,200 new moms in our 3 birthing hospitals, and we were able to show them a video. And that video was, tracked, and the next 3 years of those children's lives were followed through this study. And it showed a lot of really good evidence as to why early brain development is so important. This 2-year study here showed about a 27% increase in parent knowledge base around understanding how their baby's brain is going to develop. Some simple things like screen time and others, but just the role the parent plays with language development. You say those things like serve and return. I was a licensed tennis pro, so when I think of serve and return, it has a different meaning. But now that I've got a young grandbaby, our first grandbaby, who's 4 months old now, I'm being more intentional about that discussion. So, we did that study. That work continues to take place here through Suter Community Institute. We've just had our first kindergarten graduation rates this past time, and saw another 5% increase in kindergarten readiness. And while I'm excited about that, that's not the evidence that really drives why we're so laser focused on early brain development. So coming out of HCA 4 years ago, I reached back out to Quint and said, hey, families in Pensacola would love to kind of further this work with you. And Quint, I think, has always wanted to do this. And he talks about as he travels, even now, nationally with Healthcare Plus Solutions Group, that's one of the things that's top of mind, is talking about early brain development. So fast forward, we started Build a Brain, Build a Life, Build a Community. And we're 2 years in, 1 year into operations. Yes. You've been with us now for a new Floridian. She's been here for a year, this past April 1st. So Stephanie's been with Quint and I in this beautiful place we call Pensacola. You can see the water behind us, which is exceptional. So we're now working in 6 or 7 states nationally, and really utilizing healthcare as a means to deliver early brain development. Stephanie, I'd love for you to kind of dive into why early brain development, and kind of what's the evidence and the science and the research that supports why this is so important.
Sure. So a couple things that you've mentioned I want to pull back in. Why is this so important? With my background being in education and K-12 education, working with children, families, looking at student achievement, we know that there's a problem. We know that we need to be able to assure all of the children across our nation, really internationally, that when they go to school, they are ready to learn, that they have those skills needed so that the teachers providing that education can really take them from where they are to where they can be, reaching their potential. One of the things I think that really resonates is the 0 to 3 piece. There's a lot of research out there to support the work of early brain development, but one particular research study that we look at is out of the University of Kansas in 1995 with Hart and Riesling, and they were really interested in looking at the quality and quantity of language being used in homes across different socioeconomic factors. They looked at profession and access to resources, specifically under the age of 3, and we're going to touch on that in just a minute. But what they found through this study was that children in homes where they had less access, education levels were lower, that there was about 11 million words overheard in those homes. When you move up across different populations and demographics, you're looking at about a 43 million word cumulatively over the 3 years. That's substantial.
Right.
Hence, 30 million word gap was coined from this study. Now, many other people have replicated that study and taken a dive into that study to understand it a little better. And you mentioned Dr. Dana Susskind earlier, whom Quint partnered with originally when we started the work here in Pensacola. And so Dr. Dana Susskind was really interested in why are some of her patients that receive a cochlear implant not getting back on track and, moving along that academic trajectory compared to peers. And it really comes back to that 0 to 3 time period. It's such a critical window. That's why we named our podcast The Critical Window, because it's a critical window when so much is happening. And I'll pull back in your tennis reference too, the serve and return. So it's not just overheard language, it's actually the use of language. It's that, looking at your newborn and sticking out your tongue and then them mirroring that back. It's that back and forth, it's that open-ended conversation. So that serve and return back and forth is really what sets that trajectory for language and vocabulary and cognitive growth with our children. So 0 to 3 is really important. if we look at it from the neurobiological perspective, there's lots happening in those first 3 years. Some things that have stood out as we've shared this with other, clinicians, healthcare leaders, really anyone in the community. Language is peaking between 6 and 12 months. And that's pretty astounding for some people. They're like, really? Because I don't know about you, but my 6-month-old wasn't talking to me in complete sentences. We weren't having this serve and return. But what I didn't realize is every interaction that I was having, when I changed my voice and tone and get closer and, point out descriptive things in the environment, they were taking all those sounds in, and they were, a lot was happening during that time. They weren't yet ready to express that. I think of it like an iceberg. There's a lot happening underneath, and then it bubbles up to the surface, and that's when we begin to see demonstration of behaviors and words, and then stringing together words for sentences. Same is true for emotional control. So it doesn't just happen when they're a toddler and we're teaching them how to behave in certain settings. It's happening long before that.
Right.
So a lot happening during those first 3 years.
Yeah, I recall some of our discussions with one of the hospitals in South Florida. As we were meeting with some of the key nurse leaders, they really identified with that capacity to develop language, being 6 to 12 months of age. And we're in healthcare, and even in healthcare, you don't know what you don't know. And so I think bringing this evidence, bringing the science forward is a big piece of that. And they really identified with that. They really loved that, hey, this is an important window that we have in this 0 to 3, but specifically in that 6-month, 12-month, 6-month, 18-month period. And it's something we can control, and everyone can help.
Sure. Talking. Yeah, right. We're just asking people to talk more with intentionality.
Yeah.
And it's for all children.
Right. Yeah. I've got a 4-month-old grandbaby named Alice, and I find myself intentionally trying to have these conversations. And my first thought was, do I need to Bible back? But no, the science would say, no, use your words, Carlton.
Yeah.
You can speak to them. And so I try to get them to babble, back to me and coo and laugh and try to have these conversations. And now that I know that, I'm mindful of, I wonder how many words we just shared. I wonder how many conversations Atlas and I just had together. Yeah, as we go through that. Because I can tell you, with kids now, 27, 26, and 19, I was not intentional about language development. I really didn't know.
Well, we didn't know.
No.
Exactly.
No, and you don't know what you don't know. So while the evidence and science is so important, Stephanie, can you share a little bit about, as we look at early brain development and we look at this age of 0 to 3, is there science or evidence around return on investment? Like why? The science says do this, but what about ROI?
Right. Well, we talk about the clinical base of this, but then we also talk about how does the community benefit, economically, how do they benefit? So Dr. James Heckman, also out of the University of Chicago, has done extensive work looking at ROI and where investments in time, talent, and resources should be invested, 0 to 3. It even goes on to say waiting until age 4 is a little too late. And while at first, that's pretty astounding. But if you think back about what we just shared about that 0 to 3 time period, when 1 million neural connections are being made per second with infants, that's pretty amazing. And all those connections that are not made are kind of pruned back into the body, absorbed back into the body. So we really do have a critical window of time. And then waiting past that, 4-year-old, we think of VPK and other school settings. We've kind of missed that window. So that's what he's talking about.
Right.
That investment, which kind of goes back to why we named the company what we did.
Right.
When we build a brain, we build a life. And then when we build lives, we build community. So
yeah, absolutely. I love the science and the return on investment. And when you look at nationally, you think about kindergarten readiness. 1 in 3 kids nationally aren't ready for kindergarten. Mm-hmm. If you look at our state of Florida, we're at 51% kindergarten readiness. So, and that's what I love about this approach. So we knew one of the reasons that Build a Brain is working and Studer Community Institute has been working with birthing hospitals is because 98.6% of all deliveries occur in a birthing hospital. Right. So when you think about being able to address the whole population, irrespective of socioeconomics, our ability to be able to inform all parents, healthcare presents itself as a unique opportunity. And I think if we look at education through the lens of healthcare, it looks a little different. So here, if I was to say, hey, 1 in 2 kids aren't ready for kindergarten, that may mean one thing to one person, but if I said, hey, you've got a 1 in 2 chance of getting a hospital-acquired infection when you walk into that hospital.
Yeah, that's not okay.
That's not okay. And it needs to be the same.
Yeah.
We really need every child to have the opportunity to do great things.
Yeah.
But it starts with informing. If you don't know, you don't know. And even today, you know, we're challenged with developmental delays not being identified timely. Right. So maybe, Stephanie, talk about, as we collaborate and work with healthcare, through healthcare, and Quinn and I are pretty bullish on hospitals and healthcare as a convener for early brain development. But that's only one facet of it. But talk about how this works and what this looks like in a hospital.
Right. Well, we've mentioned inform a couple times. And so our work in a hospital, and really a community at large, is built around 3 principles: inform, equip, and support. And we're very, very focused, rather emphatic on moving from knowing to doing. It's one thing to know the data. We've got data, to be able to talk about and to create a baseline, but we've got to do something with that data. So our work the past year or so has been really building out that infrastructure so we can scale this work nationally. And you talked about we're in multiple states now. So our work in a hospital setting starts with inform. And so we do a lot of education on the front end, educating our nurses, bedside staff, anyone interacting with that new mom during the discharge process on the mother-baby floor. And so we educate. And so we make sure that they know about the importance of early brain development. And then the conversation really happens in that hospital setting. It doesn't have to happen at discharge. It can be in prenatal classes. Right. It can be, on the mother-baby floor, in the nursery, really any time. But our goal as a company is to ensure that 100% of all families have the information they need to be able to be their child's first teacher. And so we're informing, and we're using a video, as you mentioned earlier. We're educating nurses on that conversation, and we're still measuring knowledge gain. So we're looking at almost 10 years later, we're at the 9-year mark, and we're continuing to accumulate that data. And what's so exciting to me is, as we spread into different communities and have different, cultural influences, we really see the value of that knowledge gain. And so in some communities, we're upwards in 70% increase in knowledge gain. And that's important because we can't change our behavior without the information first and knowing that why. The second piece of the work we do is equip. So we have a Baby Steps milestone book, and that book is not a read aloud. It's not a narrative. It's actually designed to help walk alongside the family and caregivers so that as the child is growing, that book grows along with them so that they know those developmental milestones, speech, language, physical, social, emotional milestones that their child should be reaching. There's reminders in there about those well baby visits, and you mentioned earlier about babbling with Atlas. There's information in there about, should you use baby talk? Should you use parentese? What is parentese? So a lot of great tips and ideas and just information that just really helps to really accentuate that intentionality around conversation. So they get the Baby Steps milestone book that they take with them when they leave the hospital. And I know, Carlton, one of the things that you're very passionate about is you want that book worn out.
Oh, I want that book tattered and torn.
Yeah.
Yeah. I mean, it's a keepsake. It's meant to go along the journey with the parents, the grandparents, the caregivers, and the child, and really to better inform parents. So as you think about those key milestones, those ages and stages as the child is progressing from 0 to 3, what should the parents be mindful of? What should my child be doing, at this age? All of it, CDC, American Academy of Pediatric, evidence-based principles too, which we continue to update as both agencies and new research comes forward. So it's really exciting. And to see that get integrated into the communities, which we'll talk a little deeper about the book shortly, is where it gets really exciting.
Yeah, absolutely. So families leave with the book. They also leave equipped with opportunities to continue the learning, because we know that when they leave the hospital and go back into their community over the next 3 years, they're going to need some support. They need support from their community, from agencies. We provide support through developmental milestone newsletters. So those are sent out to them developmentally. Again, just to go alongside that Baby Steps book to remind them of those well baby visits that they need to go ahead and schedule, opportunities for them to write down things they notice and note. in their book. So that's embedded into the newsletters, as well as some of the communities that we work with also have text messaging in their community. So parents are getting deployed 2 times a week. Here's what your baby is doing at this time in their development, and here's ways in your lived environment that you can interact and enhance that brain development.
So one of the things we're trying to accomplish, and we use this term a lot, is saturation. So how many different ways, how many different times can we inform parents? So not just through the video, but through the book, not just through the book, but with Milestones newsletters that are coming out along that 3-year journey of the child, to include even reminders. Hey, have you set up your well baby visit? Autism screening, your first autism screening maybe at 18 months of age. Another one maybe at 24 months of age or 30. But really continuing to inform the parents, the texting that comes alongside with it, and then maybe some newer technologies that are coming out that we can't talk about yet on this podcast, but will be soon. So it's really, how many different ways can we create saturation? How many different ways can we inform the parents in order to better equip the parents? Because, we can equip, but if we don't know what the need is, sometimes that's hard to do. And so connecting that work along the way can be very important. So maybe spend a little bit of time, Stephanie, talking about how do we, as the parents and the child leaves the hospital, how do we begin integrating into the community, and is there a role for the community to play?
Oh, absolutely. And that's really critical to our work. The work does start in the hospital, as we partner with hospitals, because as you mentioned a statistic earlier, that gives us the optimum time to start the conversation. But yeah, so in the community, we pull together community leaders and community agencies, helping again to connect those dots. I think we'd be remiss, since we're here in Pensacola, to not mention the brain bag. It's not about the bag. It's not about the brain bag, but that did kind of stick here. And so parents know to ask about, am I going to get the brain bag? But essentially what that is, it is taking community resources, having it in some kind of bag. And we work with the United Way. They have a really nice canvas bag that they give to all their families, but it's not about the bag. It's about what's in the bag. We want to make sure that we're pulling those community resources, ways to get in touch with WIC if they have food insecurities, housing insecurity. And we know that's a real issue for some families. How to get in touch with a pediatrician, or really anything related to child development. We want to make sure that those families leave with access, information, ways to get in touch with those community resources that are already in place. But what we hear time and time again is that these community agencies are not able to get all the families that they know need the work. So we can help pull that forward from day one so that families leave with those community resources.
Yeah, I know in the last couple of days we've had meetings with Autism Pensacola. We're meeting with UWF this morning and Center for Child Development and Research. We've had meetings with United Way, Early Learning Coalition, Lena, Kinder Music, pick one. And every time Stephanie and I have meetings with agencies, either locally, regionally, state, or national, we leave those meetings just so fired up and excited about the work they're doing. But again, what resonates to me is, how do we begin to get economies of scale? How do we begin to be able to socialize that work across all platforms in order to create more saturation?
Sure.
And we've seen that. We were in discussions with a mental health program, and they have caseworkers going into the homes. And they posed a great question to us. It was, hey, if I've got caseworkers going into the homes of parents and we see a 2-year-old, is there a role for us to play around early brain development? What would you want us to say to the parent of that 2-year-old? And I love that question. And we would reciprocate and ask the same questions on the mental health side too. So maybe, Stephanie, talk about what are the different, when we think about creating an early learning community, just that collegial, collaborative, moving from knowing to doing. There's plenty of data as we move community, but really the action side of it. What are some of the different community pieces that you think about? And do you have some examples of public space like libraries and others that have really served in that role?
Sure. So we have an infographic. It's kind of an ecosystem because we really want everyone in the community to see their role. And so that's a lot of fun. And at this point, I think you and I are challenged to find a place where a community could not intersect with this work. So obviously we have the healthcare, the early learning centers, making sure that we have over 70% of moms go back to work.
That's right.
So someone is caring for their child while they're at work. And so making sure that child care workers understand the importance of narrating your day, interacting, singing, things of that nature. Architecture. When you go out into your environment at bus stops, at libraries, here we're very fortunate. We have the Wahoo Stadium here, baseball stadium. And as you go up the steps at the Wahoo Stadium, it's numbered and we have letters going up. So you probably can't walk anywhere in Pensacola where you don't see some, fingerprint of early learning and opportunities to engage with your child.
Yeah, just thinking about the Wahoo Stadium, we love our Wahoos here in Pensacola. And I remember I was going into the game last year and had a young child, probably 2 years old, counting numbers going up the steps with his mom and dad holding hands. It was so cute. And it's great to see people utilizing those tools, as simple as they may be. But, decals, placards, stuff like that, it's easy to create a user experience that creates a situation for parent-child to have early brain development experiences. What was fun about this was as we left the stadium, I guess the kid may have been like 12, 14 years old, and it was kind of a nudge to mom and daddy. He was like going, hey, any chance you think they could put some multiplication or division on these steps? And I was like, did he just really say that out loud? I wanted to get a retake. I was like, hey, can you get back up the steps as you're going down and let me video that? But it was pretty cool.
Yeah.
And to your point, you try to create saturation, and we've got even more opportunities to still further those experiences in the public sector with partners, whether it's parks and recreation. We saw some great work being done in Lafayette, Louisiana, in the parks and recreation, beautiful park, and the work they're doing. What I'm reminded of the library for postpartum. Maybe take a minute, Stephanie, and talk about that use case that we heard.
So one of our partners in Dixon, Illinois, they recognized, I think this was before COVID actually, that they had just a number of moms that were needing a support group, that had postpartum depression, and just really needed that accountability support group. And so they were able to utilize library space that was not being used. And so that work has continued and is one of the benefits of the work we get to do. We get to pull together our partners at least 4 times a year and share best practices. And what are you doing to meet the needs of moms? Because we know, again, when families leave the hospital and go back home, there's still needs that need to be met. And so I love the use of public spaces to be able to continue to support families. And that program's really doing well. They educate each month on a particular topic. There's accountability there, support there. And I think some of that nucleus group has even splintered off, and they have little exercise moms group and just, all different ways to support our families out in the community using existing space.
Right. Well, and I love that. I love what they were able to do. I love that it was simple. Anyone can do this.
Sure.
It doesn't take a lot of effort. And it's so impactful. I remember, personally, just personal experience, our third child, my wife had postpartum depression. I'm in healthcare. And I don't know what to do. I was completely lost.
Yeah.
Didn't really feel comfortable talking about it. I don't think my wife did either. Mm-hmm. And what was not top of mind was the impact of depression or postpartum depression on language development. Mm-hmm. And so if we, there's things we know in healthcare. If we know that 73% of moms have a higher disposition for depression or postpartum depression when their baby goes to the NICU, then how do we better inform and equip those moms, whether they have depression or not? But they're going to be aware of it ahead of time. And I think that's where, for education and healthcare, we need to move more away from treating the symptoms to really the preventative. And it gets back to the inform. Right. So how do we better inform that your child may be 4.5 times more likely to have developmental delays? Doesn't mean they will.
Right.
But you have a higher likelihood. And as a result, we want to make sure you're informed. Informed about the science, informed about resources available to you in the community. And I think that mental health piece is such a big piece of that.
Right. We continue to see those numbers increasing, mental health, postpartum depression. And another thing that you mentioned here is about preventative. And we don't always work in the preventative state of mind, but what we're trying to do really is preventative, whether that's in education, preventative having children kindergarten ready when they start school, preventative with some of these, data points that we talk about with postpartum depression, infant mortality, well baby visits. If we can get ahead of it by informing our community and our family and making things accessible, we can prevent some of these developmental delays and other tragic outcomes. Another thing that we do when we partner with a community is, we lean in and ask questions like, what did your community health needs assessment tell you? Is there a strategic plan within your hospital, a focus area? Because we want to come alongside that work and really strengthen and accelerate that work. So that's another piece of the puzzle. Each community is unique and has different needs, but as we go across, all the states that we're working in, there's also a lot of commonality there. Families just need support.
Right.
And they need access to those supports.
Right. Well, and I've always loved, just knowing Quint, working alongside Quint, does this work? Mm-hmm. Is it value add? Is it evidence based? And it is. And it's so important that we inform all families. And if we have 3.6 million births a year across our country, we're really charged with how do we better inform, equip, and support the parents, caregivers, grandparents, foster parents of 3.6 million births a year. Yeah. And that's very important to us. I'm also reminded as we talk about the community's role, just the ability to link all the incredible work that's being done. So when I think about social determinants of health, Build a Brain, Build a Life, Build a Community does such a great job at addressing health equity because we're providing that care to the entire population, irrespective of socioeconomic situations, underinsured, uninsured, because you're going to get world-class health care. Yeah. But, one of the things we heard from hospitals is as those families leave us, we're not sure what happens sometimes in the community. And I think this is a great way for hospitals to stay connected to the families they serve through Milestones newsletters, through connecting those parents and those children back into the community. Mm-hmm. What are you seeing in your community? What are your pediatricians seeing around well baby visits? Is it intentional? Those conversations. Right. Is it resourced? We were talking to one hospital, a very large birthing hospital, who's documenting social determinants of health in their electronic health record, but not sure really where it goes from there. So if food scarcity is an issue, do they have contact with the right agencies? Is that now something that's in this resource bag or brain bag to better inform the parents that if this is a concern, there's resources. Right. There's ways for us to equip you around food scarcity, and medical services. And we're fortunate to be in Pensacola. We have probably, if not, well, definitely the best federally qualified health clinic I've seen in Northwest Florida. And they do an exceptional job. And so when we talk about leveraging healthcare as a continuum for early brain development, we're talking about all of healthcare. We're talking about not just a birthing hospital, but moving upstream. What's the role of OB-GYNs, our OB providers? What's the role of pediatricians? What's the role of WIC, Department of Health, our FQHCs? But really, how do we collectively create saturation to ensure that every parent is informed and to the extent we can, that they're equipped and that they're supported, right? Yeah. So, how do we get that right? And I think it takes all of us. I think there's a role, Stephanie, for everyone, not just the birthing hospitals, not just the agencies who are really doing exceptional work, but for everyone. And, I think about, you use this word so well as an educator, but intentionality. So maybe, Stephanie, what's something any viewer, irrespective of who they are or what they're doing today, what's something they could do? Yeah.
Well, you kind of stole my thunder there. Intentional.
Oh, intentionality.
Yeah.
Well, that's because I love that word.
I know. But really, we mentioned earlier about moms going back to work. That may or may not be your case, but the time that you're spending with your child, being intentional, making eye contact, putting down the phone, removing distractions, and having that quality back and forth conversation that goes so far. And now that we know a little bit more about what's happening in the brain, you can almost see it firing, right? When you're talking to Atlas.
Yeah. So how many neurons? How many neurons?
A million neural
connections.
Yes. Per second. Yeah. So, being present and intentional
Right.
in that role that you're playing to develop the brain.
Right.
So, yeah.
And now we've got so many distractions. We have this thing in our hand. I think 99.6% of Americans have a phone, right? And, and that's a distraction. And so one of the things I love about Build a Brain is that we're constantly looking for new evidence, new research that's being completed worldwide. And there was a study coming out of Australia that demonstrated that, and they were following and looking at 3-year-olds, and they were able to demonstrate that 1 hour of screen time is equivalent to 67 conversations not overheard. They just didn't happen.
Right.
67 conversations. I don't know how many words that translates to, but it's got to be hundreds of thousands of words per year in 1 hour of screen time. So in the U.S., if we're averaging 2.5, 3 hours, 3 hours of screen time, 3+ hours of screen time a day, what is that impact on early brain development of our children age 0 to 3? There's impacts along that entire age, probably to adults. I'm sure we're impacted as well. But I love intentionality. I love the idea that, put down the screens. There's plenty of science and evidence around why that's not helping.
Yeah.
And then just the intentionality of language development. I use the word again.
I know you did.
Intentionality.
And I think that screen time is a future podcast because we can take a deep dive into what's happening in the brain and the limbic system when we introduce screens too early with our children. So we'll have to hold on to that for the next time. Well, I think as we bring this to a close, I think we want we want our parents and caregivers to know, being intentional and present and removing distractions is really the first step. But to inform, which hopefully we did today. Hopefully you learned a few things today. To equip and to support our communities and caregivers. And Quint talks about a missed opportunity is a missed opportunity for a child's lifetime.
Right.
When we miss every day that we miss, being intentional and present is a missed opportunity for that potential for success. So I thank you and I thank Quint for bringing me along board. It's just a great opportunity to be able to give back to communities and families in this way.
Yeah, I agree. And we're so excited about what we do at Build a Brain, Build a Life, Build a Community, and look forward to socializing more work and learning from you as well as we grow.
Thank you for listening to The Critical Window. If today's episode sparked new ideas or insights, we'd love for you to subscribe and share it with others. Visit buildabrainnow.com for show notes and resources and to connect with our growing community. Until next time, remember, every interaction shapes a developing brain.